It was 2 years ago this month. The COVID-19 pandemic really upended our lives.
In this morning's Health Watch, we talked to an Oregon doctor who was there at the beginning. Fox 4's Marilyn Deutsch gives us his perspective on where we've been and where we're heading with this virus.
As hospitals filled with COVID-19 patients, doctors were still learning about the virus. It was hard to pin down the symptoms.
We found that the initial viral illness in many times is followed by a really an inflammatory phase of illness that is much more severe than the initial viral illness.
Now we take COVID testing for granted, but that certainly wasn't the case in March 2020. It was taking too long to verify the virus that was spreading unchecked and too often proving deadly. No one knew exactly how COVID was spreading.
You're at the forefront and encountering patients every day, and you don't know if there's more than just a respiratory droplet transmission.
Hospital staffs worried for their patients, themselves, and everyone they came into contact with, especially their own families.
The concern for self-contamination and bringing this home to your family was certainly a big portion.
There was so much uncertainty. 2 years later, there are some life-saving treatments that doctors did not have at the beginning. But Dr. Pusch says these treatments are still not as good as the vaccines. He says it's always better to prevent disease than to treat it. And Dr. Pusch says the good-sized pool of unvaccinated keeps the infection going, which means we remain susceptible to COVID, even the vaccinated, because vaccine protection wanes over time. And we are still seeing new variants. COVID, he says, is never boring.
Every month, basically, we have to rewrite those suggestions and guidances for local providers, which monoclonal antibodies should be used, which drugs should be used.
Dr. Pusch also worries about long-term problems from COVID.
I think we're going to have a generation of high amount of disability relating to this, and that's very much underestimated.
Dr. Pusch is hesitant to say we're on the other side of COVID, but like others, he thinks it will be endemic.
It will be with us from here on. I could foresee that at some point it may become a more seasonal illness.
So 2 years after the first cases in Oregon and Washington, we're in a better place thanks to the hard work of all those working in medicine, and thanks also to our own resiliency. Marilyn Deutsch, Good Day, Oregon.
For more information on COVID-19 and treatments, just go to kptv.com and click on the Providence page.